Hi everyone, Garry Aslanyan here, the host of the Global Health Matters podcast. I'm at the Hygiene Symposium in Singapore. You remember we had an episode on water sanitation and hygiene, and we had Annie Masosa from WaterAid. Annie is a colleague of Om Gautam, who I just met. And Om was facilitating a session at the symposium looking at how to scale innovative approaches to hygiene. So Om, what did you learn from the session?
Thank you very much for this opportunity. In our session, we have discussed about how can we scale proof of concept intervention. In behavior change sector, it is important that we create proof of concept that lead for sustained behavior change over time. But in majority of the cases, those proof of concept are not implemented at scale. So in our session, we have demonstrated a couple of examples that has implemented at a scale under the leadership of the government. For example, WaterAid has implemented hygiene integration into vaccination program in Nepal. We have created proof of concept from pilot. Now the national government is implementing at national scale. At the same time, we have innovated technological options throughout the global pandemics, and there are other organizations who are also creating a proof of concept technology, hand hygiene technology, for example, at a small scale. And organizations are leading to implement those at national scale or sub-national scales. There are certain factors that lead for implementing at a scale. The government leadership, the financing, the coordination mechanism, the sector policy environment, all of these factors equally contribute for implementing hygiene at a scale. You remember, 2030 is just there. What we need to do, we need to implement at a scale intervention that lead for sustained behavior change over time. We have some successful example into the sector at a small scale. I think we need to do more integrated programming through existing public health program, existing WASH program, existing nutrition programming, existing education programming, so that we achieve collectively a universal access to WASH or a universal access to hygiene behavior change by 2030. Thank you.
Great. So go listen to the episode, send us messages, and let us know what you think needs to be done to achieve the 2030 goals.